Our public health testing sites are only a fraction of the testing that's going on in St. Louis County. The private testing providers do most of the tests for patients. We will continue to work with the private labs to get their testing results to patients as soon as possible. The second area of focus is testing availability. Despite a national shortage of tests, it's our responsibility to make sure we can get tests to people here in St. Louis County who need them. In addition to 2 sources of testing in our community for St. Louis County Public Health Department, we can also announce today that we are expecting this week another 30,000 saliva tests that will again provide us an opportunity for a 48-hour notice for people who have tests with County Health Department. We will make those tests available to our community partners as well. While we're ensuring that tests are available in St. Louis County, we have to make sure that they're available to everyone. So we've started pop-up testing throughout the community and made sure that when we had tests available, that we delivered them to the parts of the community that needed them the most. This week, we'll be setting up pop-up testing in high-need communities. This will be in Bell Fountain during the week, and we'll have pop-up testing in Jennings over the weekend. We are also investing heavily in adding more community locations in high-need areas. This week, we published a request for proposal from the community to seek new testing partners for testing sites. Finally, our third area of focus is timely reporting of the data. Data reporting may seem insignificant, but it is critical to responding to this pandemic. We rely on receiving timely and accurate data from test providers in crafting all of our policies and making our decisions. We use it in contact tracing and case investigation. We also use it to track trends to understand how the virus is moving about in the community. Parents need the most up-to-date data so they can make decisions about school this fall, and superintendents need the most up-to-date data so they can make decisions about resources as well. Just today, we had to pull back from sharing all of our data that we received because one provider submitted 17,700 test results in 2 batches over 3 days. This raised a concern about duplication and other problems with the data. To make sure we've got the right data on hand and that we're showing the public only accurate data, we've put in new processes to screen for accuracy and quality and the reports we get from private providers. We can also confirm today that we're working closely with the state to update their antiquated system. We expect that update to be online by this coming weekend. We hope the updates will allow us to share data more quickly and more responsively. This afternoon, I can also share that the county counselor, our county attorney, will be taking action against the provider who delivered us 17,000 test results in one data dump. We are going to work with them so they can start complying with our rapid notification order and get the test to us reliably and promptly. All of this is to make sure that the decisions we make are supported by accurate information and the information we're sharing with the public is accurate as well. These 3 areas, ensuring that test results are made available as soon as possible to make sure that everyone can get a test in St. Louis County who needs one, and making sure that the data is accurate and reliable is where our focus is today. I will conclude by adding that I hope everyone is following the new guidelines that were released earlier this week that will go in place this Friday. I know it's frustrating for many and it's costly for some as well. But we are doing what we must do to put the health and welfare of everyone in our community at top of mind. And please wear a mask. Hopefully we can get back to the option of in-person schooling for those who choose so at some point this fall. But my recommendation remains the same. Please choose a virtual school option if it's available in your community. Thank you, and I'd be glad to answer any questions.
Dr. Page, you just talked about this is frustrating to just deal with all of this. Imagine the parents at home. Every time there's a news conference, they feel alarmed, they freak out, like, oh, what's the deal? Are they doing this? Why is it still just your recommendation to go virtual for schools and not just a flat out rule, close them all together?
Well, St. Louis County will work closely with the superintendents to help them make decisions. We are limited, our health orders are limited to affecting something that is pending, something that's happening in the next few days. We don't have the authority to make a decision about what the conditions will be in 4 weeks. But if these conditions continue and the virus continues to move in the direction it's moving, if we are not able to bend this curve, then I would expect that all schools in the fall will be executing their virtual-only plans. We need to be sensitive to that. We need to recognize that we're doing everything we can to bend the curve, including the orders that we've implemented this Friday. But if this direction doesn't change, then I can't imagine any other option but an all-virtual school in the fall, at least for the first quarter. But we also have to recognize that there are many families that will struggle without a place to send their kids during the day for an in-class education, and there are many families who will struggle because they have kids with disabilities that need significant support systems. So we really need to watch how this trends over the next couple of weeks before we can make that final call. But I would recommend that every school have a plan for an all-virtual opening, at least for the first quarter, so we can be ready if that's necessary, and it looks like we're trending in that direction.
How off, we're talking about getting accurate and reliable data, how off do you feel like the data is now?
Well, everything we have entered up to date in our system is accurate. We're not going to put data in our system that we can't verify. And the state has allowed us over the past 4 days to intercept data that has been directed to them and enter it for them into their system. This is about 30% of their data. Enter it for them in their system so we can get access to it quickly and then make decisions based on our interpretation of those test results. But the paper records, all of the national providers are overwhelmed. It's a national problem with the 2 main providers that are doing over half of the testing in our country. We can see what's happening across the country, and testing has exploded. They are reporting their results directly to the state, and instead of having us wait for the state to send them to us, we're intercepting those reports. We did that over the past 4 days. We've entered that data into the state system with our employees working over the weekend, and we're still working through delayed reports of thousands of tests. We have to make sure that those tests aren't duplicates, that they aren't somehow, some other way reported to us, so we have accurate data on the system. Everything that is reported on our website now is accurate information.
Can you talk at all about we're seeing the death rate go down? Obviously, we're seeing the case count go up, but we've seen, let's say, something positive, right, and that our death rate is going down. Can you talk to that at all? Well,
the death rate is a lagging indicator of what's happening. It comes several weeks after a rise in cases. For one thing, we're testing more people who are asymptomatic, so we're picking up some of those folks that are asymptomatic, but we're also recognizing that we have significant community spread. Our positive test results among the data that we're reporting on our website, we're between 6.5% to 7.5%. Yesterday, 7.5% positive. The few tests, the tests that we were able to enter in our system overnight, we had 8% of the tests positive. So we see that percent positive climbing. But the death rate is one of 7 indicators that we track on our website, but it is the last indicator that we see when cases are increasing in our community. We're getting better at taking care of COVID patients in our hospital. We're learning more about the novel coronavirus. We're able to keep people off of ventilators. The wave of patients that we have now are younger. We've done a really good job of taking care of our older patients in skilled nursing facilities. We've worked very closely with our nursing homes to implement a lot of procedures, and our model has been recognized nationally as a best practice to protect our patients. We have regular testing of all of the employees in skilled centers as well. So that group of patients aren't appearing in the hospitals as much, and those are the ones who do poorly. But we have a whole lot of young people going through the system. We know that younger people do get sick. They do end up in the ICU. They do lose their lives. And we have to turn back this curve, because not only is it, are they going to end up in the ICU, but they're starting to fill our hospitals. They're starting to take up space in our hospitals. And very soon, if we don't turn this curve around, we will have to stop elective surgery in our hospitals, and people who are sick or people who have other medical needs will have space occupied by people who are dealing with COVID.
When we talk about rapid testing, how come we don't have that? The White House has had it for a while. Why isn't that something that we're embracing now?
Well, the newest and most novel testing protocols are going to be available to people with resources, and I would expect the White House to have the most up-to-date technology. But to get that widely available in our community, it has to be more widely available in our country. But the rapid tests, we have some rapid tests. One health system here, I know at least one, maybe all of them have rapid tests. They have a few, and those are reserved for patients who are going to the operating room, and they're using them for critically ill patients. But most, we believe that if we can get to a 24-hour or at worst case a 48-hour notification period, results period, then we can have a pretty tight contact tracing system in our community, pretty good isolation system. But we know that we're hearing reports of test results from some of our national labs, and we're grateful that our national labs are testing, but they are absolutely overwhelmed. Some of patients are 7 or 10 or 14 days. I had one family tell me this morning that they waited 17 days for their test results. They had to stay at home. They couldn't go to work. Their life was dramatically interrupted waiting for a test result. And we have to do better. We have to get this testing down. So we're doing everything we can to help the state process these claims, because there are so many coming in that they're becoming overwhelmed as well. And we're going to react to those claims, and we're going to see if we can provide a better testing solution in our community and diversify our testing providers as much as possible. And that's why we're excited that we will have this new saliva test this week to deploy in our community with a much quicker turnaround time. But that is still, that's still a 24 or 48 test, that 48-hour test. That's not a immediate result.
And I want to follow up to something you mentioned. This might be wrong when it comes out, but you talked about that testing provider gave you a couple of batches with this number. That was kind of a shock to the system. Some days, and then we look at the daily updates from you all before news conference, it doesn't always match the numbers on the website. What's the discrepancy and why?
Well, some of the tests are reported to the state first, and then they come to us. Some providers report directly to us, and that's why we're excited about the new technology that the state should have by this weekend that will do this electronically and allow these test results to move. We go through a lot of work to make sure that we're not duplicating any test results, that each test result we have is from one individual. And that's a big process to deduplicate these test results. But we, last week, towards the end of last week, we were able to help the state enter several thousand test results that were backlogged. We had to make sure they weren't duplicates, and then we entered them into the state system. We had access to them for our system, and we were able to see a really alarming increase over the past week in the 7-day average. Our tests have increased 250%, 240% over the past 4 weeks. This is not the rate of increase that we had back in March and April, but it's a rate that we can't accept, and we have to get it turned around.
The positive number has increased that much?
Yes.
I want to ask something, and just again, my curiosity. I remember when we started playing all those videos, like at the Ozarks and other places with crowds, that July 4th weekend, there was a sudden pause of concern.
Yeah.
Are we at that point? That's why we are seeing these numbers go up now. Can you really attribute that to all of that from that time frame, or is it just something totally different?
Well, I'm sure that contributed to some of our spread in the community. It just statistically, it would have to. I think anytime you have a gathering of several hundred people, young people without masks, you're going to have spread. Young people or not. Anytime you have a gathering, you're going to have spread. So statistically, somebody will be there who's positive and asymptomatic. And that's why one of our orders is to limit gatherings starting on Friday. Hopefully we'll only have to do this for 4 weeks. We can slow this down. We can improve the testing environment in our community. We can get more rapid results from our tests, and that will allow us to respond to this in a more traditional way. But we have to bend this curve.
And I know you said that you look at this every day. You don't have a target date to say, oh, let's assess it, let's change some things. This is kind of fluid. What's the next step? Because here we are rolling back some things now, starting restrictions on Friday. Let's deal with that. But what's next if we don't do better as a community?
Well, the same thing that we see across the country. We're in a better place here because of the decisions we made in the past. And I'm hopeful that this partial rollback to 25% capacity will allow us to continue to function in our community, to let people continue to get the services that they need to keep our economy going, but significantly impact the spread of the virus. If we are unable to get universal mask adoption, if we can get everybody wearing masks, not only in St. Louis County, but in our surrounding communities, get everyone wearing masks, that will have a great impact. And that's really one of the most important things we can do. In addition, we have to respect our social distancing guidelines and get this virus turned around.
Okay, and I have a two-part question on a different topic.
Yeah.
There was some audio released yesterday or a short time ago of you telling Lieutenant Colonel Troy Doyle that you control the police board. How do you respond to that?
Well, that's not exactly what the audio said. That is an interpretation of it. But generally, we were talking about recruiting Colonel Doyle to lead the department review of the police department, and I had the support of the police chief and the chairman of the police board for Troy to have that assignment. That's certainly an inartful description of already having that commitment, and looking back, I would have chosen different words, but that communication had nothing to do with the selection of the chief, as that has been displayed. And I recognize that we are, we're in a political cycle, and these sort of things are presented that way. That's part of the process. We'll just let this process play out. Colonel Doyle was my choice for chief. I thought he would have been a good chief. The police board, who is independent, chose someone else, and I'm going to work with the new chief. I hope Colonel Doyle will continue to work with the review of the department. The actions of his attorney are something different. There was certainly an appearance of extortion, and I know the prosecuting attorney has referred that to the U.S. Attorney's Office, and we'll let that process work.
And a lot of things has happened in the county, and we've not really seen Chief Barton around. Where is she? How is she doing? What's her process with all of this going on? It's not her directly, but a lot of the attention is against one of her, I guess, top competitors for the job.
Well, I think Chief Barton has been around. I think we should give Chief Barton a chance to lead the department. She was chosen by the police board. She is highly qualified, and I'm sure she is participating with all the duties that a new chief would do. She's been in office 3 or 4 months. There's a lot of processes there, and we should give her a chance to lead the department.
Thank you.
Doug, do you have any other questions?
No, everybody answered the questions.
Okay, thank you for coming out. I'll just say it one more time. Please wear a mask. It's important. It is part of what we're doing. Thank you.